right, I'm going to click this. Thanks, Jen. I'm Dr. Nate Berger from Case Western Reserve University in nearby Cleveland, Ohio, and where it's, I think, 12 degrees outside. I hope you're probably having similar weather around Pittsburgh, and I hope you're all warm and cozy in your house. This is a nice way to give a seminar without needing you to come out and come to it, so you can all be on your on Zoom with us. And we're going to talk today about sarcopenia. And again, thank you for having me here at the Pittsburgh Cancer Bridges program. And again, Jen mentioned, please feel free if you don't understand anything, or even if you do understand it and you have a question, just ask the question. Just speak up and ask the question, and I'll try and answer it. If not, we can answer it afterwards at the Q&A, or if you want, just type it into the chat, and Jen will ask me the question. Let's see if we can move the slides now. All right. What do we have to do to move the slides? We'll click here. Okay, so again, we're going to talk mostly about sarcopenia. It sounds complicated. Sarcopenia comes from, it means loss of flesh or loss of muscle mass. You're probably familiar with a lot of words that end in penia. Most of you have probably at least heard the word anemia, which means your blood count's low. Osteopenia, probably a lot of women are familiar with this, which is loss of bone. And you get put on calcium pills because women seem to lose bone calcium more than men. Leukopenia is a problem where your white blood cell count is decreased. Leuco means white, penia means a loss of it. And this is a problem that a lot of patients experience when they're undergoing chemotherapy, and there are special medications that you may get along with your chemotherapy to prevent you from having leukopenia or neutropenia, which is loss of a specific kind of neutrophils which fight infection. And again, sarcopenia means a loss of muscle, loss of flesh, or a loss of muscle mass. Now, sarcopenia is used medically 3 different ways. One, to describe a condition. So we say someone has sarcopenia, and that's the condition. The other is it's a process. And the third is it actually can be a disease. So when we're talking about sarcopenia as a condition, we're talking about decreased skeletal muscle mass, decreased skeletal muscle composition, and decreased skeletal muscle strength. Now, again, if you're not familiar with, I'm not sure if you're familiar with this or not, but skeletal muscle is the muscles that are attached to your skeleton and make your body do most of the movement. Your heart is a muscle that's not skeletal muscle, that's called cardiac muscle. And you have what we call smooth muscle in your intestine and a lot of parts. Those cardiac muscle and smooth muscle are not part of sarcopenia. Sarcopenia refers only to skeletal muscle. And then in addition to it, there it is. In addition to being a loss of skeletal muscle mass, it's really a change in composition. So when people develop sarcopenia, instead of having red muscle fibers, they have, it turns out, a lot of fat in their muscles. So that's the change in composition. And all of that results in a decrease in strength. And then there are lots of complications of that. Then sarcopenia as a process is the gradual loss of skeletal muscle mass. And it's a natural part of the aging process. And I'll show you that later. Everybody has it. As soon as you hit about 30 years old, and I expect that most of you, except I think I saw a few students on there, are probably at the point where we're all undergoing the process of gradually losing muscle mass, and that's leading to sarcopenia. And then finally, sarcopenia can be a disease. That's when you have the excess loss of skeletal muscle mass, and that can lead to falls and fractures and functional decline and disability and death. So this is a really serious process. And so how prevalent is sarcopenia? Well, anywhere's, depending on which community you go into, anywhere's from 1% to 29, 30% of people just out in the community have sarcopenia. If you look in institutions like hospitals, it's anywhere from 15 to 33%. If you look at people over age 80 years old, 50% of those people, just random sample of people over age 50, 50% of them or more are going to have some sarcopenia. If you look at patients with cancer, anywhere from 15 to 50% of patients with cancer will have sarcopenia. And at least 18% of, if you look at all Americans across the board, at least 18% of them actually have sarcopenia. All right, now this is a very complicated picture and it shows you what a muscle is. So coming back here is a piece of muscle, which is essentially what you're looking at when you look at red meat. It's that's what muscle fibers are. Whoops. You want to do that. That's what muscle looks like. And then muscles are broken down into small groups called fascicles. And each one of these fascicles can be broken down into a muscle fiber. And then each one of these fibers is broken down into chemical filaments, which make up the muscle. And the important thing I want to show you here is this whole thing, consists of a bunch of these muscle fibers as one little cell up here. This is the muscle cell nucleus. And this cell, which contains the DNA, is responsible for making all of this muscle fiber. So this has got to do a lot of work, and it's got to do a lot of work all through your life. And these begin to decrease over the course of your life. And this is part of what's responsible for the decrease in the muscle. Did anybody understand that? Does anybody have any questions about that? Okay, we'll go on. All right, so here is your arm bone. Here's your humerus, and here's your ulna and your radius. So this is the arm, and this is the forearm, and here's a muscle connecting your upper arm to your forearm. And when this muscle contracts, when it gets shorter, that's how you're lifting a weight up to your chest. That's how you're lifting your cup of coffee. That's how you're picking up food off your plate. This is the muscle that you have to contract if you're brushing your teeth, combing your hair, any of that where you would. And here we show you in an older person or someone who's got sarcopenia, you see, first of all, the belly of the muscle is smaller. And when you look again in this cross section at these fibers, or if you're cross-cutting a piece of meat, you see here all of this red material is the muscle, and these white lines are fibers that help hold it together. But here you see in an older person that a lot of this muscle mass is being replaced by these fibers. And this is happening for two reasons. First of all, the fibers are growing with age. And second of all, as you age and with certain problems, you begin to lose this muscle mass. So this is what sarcopenia looks like under the microscope. When we take a look at a section of muscle. And again, just to show you what we did, here's an arm, and if we were to take a cross section, that is, if we cut here and then turn it sideways and look at it, you would see that right down the middle of the arm, there's a bone, and then there's the muscle mass, and around that is the skin and a little bit of fat. But if we look at that same cross section in a person who has sarcopenia, you see same bone, much less muscle, and more fat, and yet the arm, is basically the same size, but it's not as strong. Was that a question, or you're just trying to? Okay. I saw a hand waving.
Someone did ask a question. Would you see
Oh,
that on an MRI?
well, so here's a great question. Nice setup for this question. Here actually this is CT, but I mean, basically it would be the same thing on an MRI. This is the thigh. So here's the femur. That's the bone. Just imagine this is a long bone going up and down. And here is the why do I keep losing my hair? There it is. All right. So all of this is the muscle in the leg, all the different muscles. And here is the skin around the outside. And look at the difference. This is the answer to your question. You can see in a sarcopenia, the muscle is much less. And you can see there are all these fibers between it. So yes, you can see it on a CT. You can see it on an MRI. And that, in fact, is, I think, yeah. So there are several ways that we have to look at it. One is a DEXA scanner. Most of the women here have probably undergone DEXA scanning when you were younger to see your bone density. So what happens here is you're laying on just on a bed and you just have this arm, which is giving you low dose X-ray, and it just passes over your body from head to toe. And it gives a low dose X-ray and it measures your skeletal muscle, your skeleton mass, and your muscle mass. We can calculate. This is one way to calculate your muscle mass. And the important thing about this kind of test is it's a very, very low dose X-ray. So there's really not very much in the way of radiation uh, from uh, from from this. Another way that we do it is computerized tomography, a CT scan. Probably many of you have had CT scan. This is a donut, and in this donut is all X-ray sources, and this bed moves through the donut, and as it goes through the donut, you're taking X-rays which are at a much higher dose of radiation. Is still reasonably safe, but still higher dose of radiation. And when you go through this, it gives us a picture that looks like this. So this is the picture in the middle of your back. It's a cross section across your back. Here you see your spinal cord, your vertebrae. This is a disc. This is, and these red, uh, uh, what's indicated in red here are your muscles. These are the muscles in your back that run up and down your back. These are the muscles that wrap around your body, around your ribs. These are some of the organs inside, but you can see here in a normal person how much more the muscle is compared to a person who has sarcopenia. You see the way these muscles are over here on the right are beginning to degrade. So again, this is a cross section by CT. If you did it by MRI, it would look very, very similar. And then those are the way we actually those are some of the ways that we measure muscle mass. And the other thing that we do is we measure your strength with a hand dynamometer. This measures your grip strength, and your grip strength has been has been validated as a good indicator of what your strength is. It's portable. I don't know how many of you have been exposed to this, but this is a simple way. You squeeze it 3 times, and they take the average of your reading, and we can follow your changes in your strength that way. Jen, is there a question in the chat box that we should answer now, or?
I don't see one.
Let me see. I'll see. Oh, it's same old question. All right. So I see we already answered that. It's still in my. So would you see that? All right. So now I said that muscle when you reach the ripe old age of 30, is everybody here is 30? Mostly everybody's okay. So here's what happened. Once you hit 30, from 30 to 60, you lose muscle every decade, 3 to 8% of muscle loss per decade. That's normal. That's okay. That's no problem. Well, I mean, it's an issue. I wouldn't say it's a problem. When you hit 70, it begins to go a little bit faster. You start losing 15% muscle loss per decade. But again, it's 15% per decade. So it's only under normal conditions, that's 1.5% per year. So it's not so bad. I mean, we all, deal with that. There is something we can do about it. We'll talk about that later. But losing muscle mass is a normal process that goes along with aging. And here's, the picture of, here's where we start off, and, you grow up and you gain muscle mass. And then here, about 30 begin to lose muscle mass. And as you continue to lose muscle mass, you see here, this gentleman's a little bit more frail and is using a cane. And we all know people all along this spectrum. And I'm sure, everybody could name somebody here, here, and here. And probably we were all in this situation, and we're all sort of headed towards this situation. Hopefully we're not going to wind up here. And we'll talk about how movement and muscle and exercise can help prevent this deterioration. So again, the numbers, if you look at 65 years old, nearly 25% of people who are 60 years old actually have sarcopenia. This is when you have too much muscle loss. And by the time you're 80 years old, 60% of people, these are people just out in the community, have some degree of sarcopenia. So again, here's a different way of looking at the same thing. You're born, your muscle mass, as you grow and develop, your muscles increase. And then depending on how much disability or how much you exercise, people who have a lot of muscle, and people who have less muscle. This is usually a difference related to exercise. And then your adult life, the question is, how long do you maintain this much muscle mass? And it is mostly dependent on your physical activity, your exercise. If you don't exercise, you don't maintain physical activity, it goes down faster. And then as you get into older age, you see there's a bigger separation, and you reach a threshold where once you get below that threshold, then you begin to really have problems because of your decrease in muscle mass. And this is a more complicated slide. Again, this is looking at a muscle, and this tells you that your immune system contributes to aging in your muscles, and a lot of different things that cause inflammation change your muscles. And I'll go over, there are a lot of different processes in your body that contribute to decrease or changes in your muscle mass. So here are some of the things. So one we call is immunosenescence. So when your immune system gets older, it begins to sometimes attack some of your muscles, and that leads to sarcopenia. Things that you do to cause increased inflammation. If you have an infection, that'll lead to inflammation. There are foods that you eat, like some of the fast foods, that can contribute to inflammatory foods. Mitochondria, I don't know how many of you are familiar with mitochondria, but those are the powerhouses inside your cell that are responsible for making all the energy in your body. They begin to deteriorate with age. Here I am. Malnutrition, if you don't have enough protein, it's really important that you keep up your protein and some of your fatty acids. Chronic diseases, anything like, we'll talk about cancer, but diseases, even like rheumatoid arthritis and lung disease, all of these can lead to sarcopenia. Remember I showed you there was that little bitty cell on the outside of the muscle that is responsible for making the muscle fibers? That's called the satellite cell. And as we age, the satellite cell, both its number and its function decreases. Altered proteostasis means that our body handles proteins differently as we age. So it's important to keep up the protein that we take in. and try and overcome misalterations, hormonal levels, especially in men where the androgens begin to decrease with age, growth hormone begins to decrease. So that contributes to sarcopenia. Another important one is sedentary behavior. The more we sit around and watch the screens, the more that contributes to the development of sarcopenia. So all of these things are important to be conscious of. This is, I guess, a less technical way of talking about it. Decreased physical activity. That's what these are all causes of sarcopenia. Anorexia of aging. That's a lot of people as they get older, they want to eat less. And that can lead to sarcopenia. I talked about the decrease in those cells that help build the muscles. All of you know about the arterial disease and changes in your blood supply. And so that can, if you get decreased blood to your muscles, you can get, you might find that you have a lot of muscle cramping. That can be due to decreased blood supply. But in addition to cramping, it's also cutting down on the growth of your muscles. Hormones like growth hormones, they begin to decrease with age. This is controversial. If you're really small when you're born, sometimes that leads to decreased muscle. Sometimes people who are small at birth actually grow to be pretty big. This is another hormone. This is the male hormone, testosterone, and something called cytokines. These are circulating hormones from the immune system. They can lead to sarcopenia. And again, the most common, all of us age, and sarcopenia is a natural part of aging, or at least loss of muscle mass is. And so,
I'm sorry, Dr. Berger, there's a question. How much protein per day is good? I'm 70 years old.
at least 2 grams a day.
2 grams?
Yeah, I think that's, or maybe it's 2 grams per kilogram. I'm sorry. So here we have sarcopenia leads to frailty, and frailty, is when you can't get around, when you can't do your normal activities of daily living, and that leads to functional decline. And functional decline runs in parallel with falls, and that puts you in a situation where you can't take care of yourself, so you become more dependent on support services, and that leads to morbidity where you're really sick, and that can lead to death. Again, these are overlapping conditions, sarcopenia and frailty. And as I said, sarcopenia can lead to exhaustion, and it can lead to more sedentary behavior, that is lack of activity, and then those overlap to give you weakness and slowness and shrinking. And all of these set up a vicious cycle, leading to frailty and then to malnutrition, because you can't get up, and make sure you take care of your food for yourself. And that leads you to sarcopenia, and that leads you to bone loss, and that leads you to more stress and breakdown of tissue. And as bad as that sounds, it gets worse, because sarcopenia can accompany other disease. And, in the picture that I showed you earlier of the aging men, he turned out to be really thin, but you can also be sarcopenic and obese. That is, you have too much adipose tissue, too much fat, but you lose muscle. And then, of course, there's a potential problem of sarcopenia and cancer. And the cancer itself can cause the problems that lead to sarcopenia. And then it sets up a vicious cycle. And so we'll talk about it. So here's
a few more questions. Can you go through menopause? Can going through menopause lead to sarcopenia?
So, so remember, so I mean, I think the overall answer, the simplest answer would say yes. But I would say, but so I think, it's important to qualify that in a lot of ways. So going through menopause, if, for some reason that makes you not want to eat, that could contribute to malnutrition. On the other hand, menopause could also, I guess, in some cases, lead to obesity. And that can cause, sarcopenic obesity. But I mean, I think the thing is, and you may talk about this some other time, is, if you go through menopause, and decide that you're going to be really committed to physical activity and continue to go to the gym all the time, or to some place where you're sure, you can keep working out and do Pilates, various kinds of exercise, that's a good way to counteract the effect of menopause on the development of sarcopenia. So the answer is yes, but you can deal with it.
And the second question is, can it be reversed with movement, etc.?
For sure. And we'll talk about that in a little bit. That's really the key. So here's, again, sarcopenic obesity, increased adipose tissue mass, that's increased fat. And that leads you to fatigue. And when you get fatigued, you cut down on your physical activity, it increases your immobility. You get these inflammatory cytokines. I mentioned that before. And there's something, fat tissue doesn't just isn't just a storage place for excess energy. Fat tissue also makes these hormones, which are called adipokines, and most of them are not good for you. They cause inflammation. And so all of these processes lead to decreased muscle mass, increased fat in the muscle, which weakens the muscle, and then decreased muscle strength, and that's sarcopenia. And it also can contribute to insulin resistance, and insulin resistance is sort of a technical term for diabetes, so it leads to diabetes too. And again, normal muscle, and here you see this is your shoulder and your arm, and here you see loss of muscle, and here you see this gentleman's developing somewhat of an abdominal pouch, and that's sarcopenic obesity. And so you see, you have this situation where you have obesity, you have sarcopenia interacts with age, all giving you sarcopenic obesity. And here's two of the things you see. This sort of symbol means that you're blocking the development. So exercise training is probably the best. And one of the drugs that's still under investigation is resveratrol, which is being touted as slowing down aging. I think you can't just you can take this in pills, but you can't just take a pill or chew a gummy with resveratrol in it and figure that's going to do the trick. You really need to continue your exercise, your physical activity. And again, here are these pro-inflammatory cytokines and these adipokines, and they're coming from the fat tissue, and they're working against the skeletal muscle and leading to our sarcopenic obesity, and it's all being helped by aging. And again, here is how it's cancer related. The tumor affects you, the host, and cuts down your appetite, so you decrease your protein intake. And here, the tumor is causing pro-inflammation, and so you get increased protein degradation. You need to reverse that. Treatment for cancer, like chemotherapy and radiation, all of which can promote sarcopenia. And then while all this is going on, we're all aging. And so all of that contributes to sarcopenia. And again, just to emphasize what's going on in cancer, you see, if you have cancer, you're probably getting either chemotherapy or radiation toxicity, or chemotherapy or radiation therapy. That can cause toxicity. Sarcopenia can make that toxicity worse. If you have sarcopenia while all this is happening, there's a high probability that the cancer is going to progress more quickly, lead to your death. And the chemotherapy, if you have sarcopenia, is going to probably lead to reduced chemotherapy dose, which will also contribute to cancer progression. Are there questions, or did I see there?
There is a question. If you suspect this is going on with yourself, what kind of doctor do you see? And what type of specialist? And is there a blood work panel they can use?
There is not a specific blood work panel for sarcopenia. There is a blood work panel where you can measure your serum albumin. You can measure different parameters. There are different blood tests that you can measure to tell if you have inflammation. These are some of these cytokines that I mentioned earlier. Most of your doctors can tell you. You're very, so this is a really big, important area of research, and you're fortunate in Pittsburgh to have at the Hillman Cancer Center to have Dr. Katie Schmitz, who I think was on your program, or Jen can certainly tell you how to get in touch with her. Many of you may know Dr. Schmitz, and she runs a really big both program to increase exercise, especially in older folks, but in patients with cancer. And she has a number of studies going on and a number of practical guides for this. And I would say that, Jen, if you need a referral for anybody, either ask Dr. Schmitz or get her to specifically refer. It used to be that oncologists, that your cancer doctor used to say, oh, you've got cancer, don't exercise, don't worry about it, get a box of candy and just enjoy yourself. That was wrong, and we've really changed from that now. Most doctors, most oncologists now understand the importance of exercise. They should all be telling you to exercise. In Europe, actually, that happens when you're in the hospital with your cancer. The gynecologist comes to see you, and right after that, the physical therapist and the exercise doctors come to see you. We're getting to that place in the United States, but as I said again, in Pittsburgh, you're lucky you have Dr. Schmitz there, and there are doctors like that all over the country. But I would again refer you to Dr. Schmitz. Did I answer that question, or was there more?
I think that was it, but I will add on to that. Like, is there a way to measure it? Like, for instance, I think, would a BMI be accurate? Is that a way to measure it, or?
Well, so the way we measure it is what I showed you in the beginning.
There's three.
There are three things. I mean, you can do a DEXA scan. You can ask the question, like a lot of times, depending on what kind of cancer you have, you are either getting a DEXA scan or you're getting a CT scan. Like everybody who has any cancer in their abdomen has probably had at least a CT scan, if not an MRI, and you can ask the doctors to look at that scan and see whether you have sarcopenia on there. They don't have to do another scan. I mean, unless, you want to know if it's changed, but if you want to know what it is, at the time you had the scan, you can do it. And then the measurements, and you can ask your doctor to refer you to somebody who's got one of those dynamometers, that hand grip, to tell you whether you're below average for your age. Yeah, so I gave you the bad news. Now here's the good news. Remember, the bad news again is that sarcopenia is muscle loss, but it's preventable and it's reversible and treatable without medication. We don't really have a pill that we can give you and say, here, this will reverse your sarcopenia, but it's quite clear that the most important thing to reverse that prevents sarcopenia is physical activity. And the more, the better. Don't run out and buy a 200-pound barbell and start trying to lift it, but there are programs to increase your movement and to gradually increase your activity. And I said your protein-based nutrition is really important, and I think it's the 2 grams per kilogram of protein. Almost all of your doctors work together with nutritionists, and I think you can. It'd be a very good idea to go see get a consultation from a nutritionist who can go over your diet, who will give you like what they call a 3-day recall to see how much protein you're taking in. And one of the important things is that you, when you're increasing the protein in your diet, is you increase it with healthy foods and not with junk foods, because the junk foods are really causing a lot of inflammation, and then that way it's working against you. Physical activity, both aerobic and resistance exercise are important. Resistance is the most effective for building a muscle mass. I don't know how this got in here, but resveratrol is being used more experimentally. Vitamin D is helpful. You should be sure that your vitamin D levels are normal. That you can have the doctor just draw blood and measure. And it's something that's experimental. A lot of people are talking about taking this nicotinamide riboside to prevent aging. I don't know if any of you are aware of these programs to boost NAD, or you're taking it. They probably help a little bit, but we still have to work out how the best way to give this medication is. So I said that you know that there's 2 kinds of exercise. There's resistance exercise and there's aerobic exercise. So here's resistance exercise, and increase your muscle mass, and these will give you beneficial effects on sarcopenia by changing your hormones a little bit. This will change the way your tissue breaks down. Resistance exercise and aerobic exercise will obviously counteract immobility or physical inactivity. Aerobic exercise, walking, running, swimming, tennis, ping pong, all of those aerobic exercise will help reduce the amount of fat in your muscle. The resistance training helps prevent some of the neurological changes. I told you about the mitochondria that are powerhouses of your cell. The aerobic exercises help improve that. Both types of exercise help cut down on inflammation, and the aerobic exercise helps improve blood flow to your muscles. So I think what's generally recommended is that you do aerobic exercise every day. Get in 20 minutes to a half hour of walking, running, jumping, just moving. Jen can tell you more about what moves to make. And then 3 days a week, it's a good idea to do resistance training. And again, as I said, you can start resistance training with just a couple of cans. You can, if you have dumbbells, some places use ribbons, some places use these bands, but any of those are good. And I think your program at Cancer Bridges is probably a good program for you to get sort of trained in how to do that safely and effectively. Is that right, Jen?
Yes.
Okay.
There was a question here. What is 2 grams per kilogram for protein? And that I'm not real good with kilograms, but it's like 2 pounds per kilogram, right? So is that
Yeah, yeah, it's about 2 pounds. So if you take your pounds and you divide them, just, I mean, roughly, if you divide it in half, an Berger should be eating about 2 grams
Of
for.
like of body weight. So if you're 100 pounds, you need 50 grams of protein. Is that?
Oh, I think you're talking about 100 grams.
Oh,
Yeah.
okay.
Yeah. All right. So again, just to summarize, sarcopenia is decreased skeletal muscle mass, composition, and strength. And the major causes, there are many. Age is just a natural cause, genetics, inactivity, immobility, illness, inflammation, nutritional deficiency. Consequences are weakness, frailty, falls, functional decline, comorbidities, and death, mortality. One of the things that we worry about as oncologists is when you're sarcopenic, we can't, we think that we have to, you can't tolerate chemotherapy as well. So it's a reduced dose of chemotherapy. There is a big study going on at the Hillman Cancer Center right now and at Case and at Harvard. The three of us are working together on a study called Thrive 65, which is for women over 65 years of age who are getting chemotherapy for breast cancer. And this is the exercise to see if that will help us, allow us to give you your full dose. And that gives you a much better chance of beating the cancer and living longer. And the prevention and treatment is physical activity and exercise, improve your nutrition, certainly see a nutrition counselor or nutritionist to help you with this and control any contributing diseases. And so we'll see you all in the gym. So I think that's what I wanted to say, and I'll be glad to answer any more questions.